Well, thank you so much, Debbie. My name's Jeannette Koijane. I'm the Executive Director of Kōkua. I'm going to talk first, and then my colleague, Hope Young, who's our Advanced Care Planning Coordinator, she's going to take over. We're really pleased to be here today. We'd love to know who's out there, if people want to introduce themselves in the chat, so we know who's there, because of course we can't see you, you can only see us. Okay, so first slide, Hope. There we go. So who is Kōkua? So we are a statewide coalition. We're a hui of organizations and individuals that is committed to improving care for people with serious illness. We are going now on 22 years here in Hawaii, and we hope that people will come and learn more about what we're doing, get involved. So we do things like this, where we go out into the community, and I'll talk about that in a minute. So we're a membership organization. Thank you to Navian for being one of our members, we're along with health systems and health plans and all sorts of other groups in our community that is pitching in to make this work. It's actually unique in the country to have a hui that works with people with serious illness that's membership driven. We also have amazing volunteers. Hope and I get to work with amazing people. And if after today you think, "Ooh, that's something I'm interested in," just give us a call. So we like to think that we want to start early with this continuum, talking to people early, trying to break the ice, get people less afraid. And we also want people to so thinking about advanced care planning, which includes advanced directives and POLST. We want people to understand about palliative care, which is what we're doing today. Hospice care, separate from palliative care, and then some of the other resources that we have are around grief and bereavement. Next slide, please. So we approach this challenge in 3 ways. So one, and probably the most important thing, is that we try to put people with serious illness at the center of the work that we do. And we say this, people who may be facing serious illness and their loved ones. How do we help people get good information, understand what decisions they might need to make, and then to find resources and information? So people say all the time to us, "Oh, I don't really need that." Well, you know what? Better to be 10 years too early than 5 minutes too late. You never know when something's going to happen. And what I find all the time, and especially in Hawaii, where we all take care of each other and watch out what's happening, you know, your friend may be caring for their parents. Somebody might be caregiving that needs this information. So we really want people to get the information. So we have a newsletter that you're welcome to join. It's free. We do talks, all that kind of stuff. We do trainings also for professionals. Yesterday we did a talk for nurses about palliative care. Last week we talked to the Public Health Institute. We are interested in having people understand this work. And then the final thing we do is looking at policy and legislation. I'm a public health person, and I firmly believe that if we could get the health plans to pay for something, like when HMSA started supportive care, that was a game changer. We need to look at the systems and how they work in order to move the needle on this. Okay, next slide. So we like to say that we're a movement. We want to make advanced care planning and also open communication about care and support for people with serious illness, or those who may be facing serious illness and their loved ones, always have a team approach, the cultural norm. So by coming today, we hope that you will learn things about what's out there, ask questions, and hope you're up next.
So we're going to start with an icebreaker. Share with us in the chat, when you hear the word palliative care, what comes to your mind? We'll give you a minute and we'll kind of take a look at it.
And don't worry, just put it down, see what comes up for you.
And if you're totally unfamiliar, just say it's all new to me. That's fine.
Right. That's a good answer. I have no idea. My daughter made me come to this. Isn't there free chocolate later? So,
Oh, the chat is disabled.
chat is disabled. Well, that doesn't help.
Yeah.
Because I also thought nobody's introduced themselves. That's like exciting. Nobody's
We're
really
having a
out
lot
there.
of issues with Zoom this morning.
Yeah, isn't that exciting?
You know, on my end, it says it works, so I'm not.
I don't know. Chantel, you could try and chat something. It says I'm allowed to click on something and
You try now.
Try now.
everyone is an option now. In
Oh,
my
there we go.
Yay, there we
Yay,
go.
okay, good. Okay.
Okay. Now you should all be able to put something into the chat. Tell us what comes to your mind when you hear palliative care. Lynn says it's new for her. Help me, help us. Got some newbies, support.
We love it.
Hey, Anita.
Oh, good. A lot of people who are new to this. That's great.
Cancer comfort. Okay. Great to have all you folks learning about palliative care with us today. For those of you who may have heard of it before, we're hoping to make sure that you understand that there is a difference between this and hospice. So we want to make sure we clarify it and help your responses so that at the end of this, you can say, yes, I know what palliative care is, and yeah, we want that. So welcome to our palliative care discussion. These are some words that come to mind when folks hear the word palliative care. And I realize it's a little bit small unless you're looking at a big screen. But this is our wordle. So palliative care is often a misunderstood term, and it means different things to different people. So we had this great little video that we wanted to share with you, and unfortunately, we are not able to show it, but Debbie's going to send it out later on so you can watch it and learn more about it. Oh, but can you hear it?
Yeah, there's no sound.
No sound. All right. Then we'll just move along with that. Our goal for today is to show how the extra layer of support of palliative care that can help someone live well with a serious illness. The short definition of palliative care is that it helps people with serious illness stay at home rather than having to go to the ER or to the hospital. It reduces physical discomfort, improves quality of life, and makes living with a serious illness easier. It's meant for not just the person who has the illness, but it's also for those loved ones who help to care for them as well. What is it? Well, it's a specialized medical care that focuses on providing patients with relief from the symptoms and stress of a serious illness. The goal is to improve quality of life for both the patient and the family and loved ones. It's provided by a specially trained team of doctors, nurses, and other specialists who work together with the patient's other doctors to provide that extra layer of support. It's appropriate at any age and at any stage of a serious illness, along with curative treatment. Palliative care is based on need and not prognosis. So some of the messaging and that resonates with patients and loved ones, just how this can be so helpful for you. It helps people to stay home and avoid the ER and hospital. It's providing the best quality of life, relief from symptoms, pain, and stress, makes living with serious illness easier. It's appropriate at any age and provided alongside curative treatment. Matching treatment options to patient goals, and it's a team approach that helps the person and their team. Remember, we're looking at this from a team-based orientation. So we want to have everyone on the team working together to provide the best care. And it's providing an extra layer of support. If any of these messages resonate with you, feel free to drop that in the chat for us. We'd like to hear what people learn from this and what they feel is the most important that could benefit them and their loved ones. So feel free to drop it in the chat. Let us know which one resonates with you. Okay, so if we're looking at what palliative care is, it's a big bubble, right? So we're looking at people with serious illness, and you'll look at this and then you'll see in the bluer bubbles, we have hospice. So palliative care is around hospice, but it's not the same thing. It's also provided by the same teams that provide hospice. So we want to make sure that folks recognize that hospices are set up so that they can provide that team approach, which is why they actually offer palliative care through their services. We had another great interview with, this is a woman, her name is Andrea, who actually, she was a caregiver and she got palliative care, and she's just telling us her story of how it really helped her and her family through her husband's cancer journey. And of course, we'd love to share it, but our sound isn't working, so here we go. So palliative care helps you live as well as possible for as long as possible. Palliative care is the way it should be when facing a serious illness. When everyone involved in the patient's experience does their part, we all see the benefits. So improving the experience for people living with serious illness is not just a good thing to do, it yields practical benefits, and it also is really efficient within the system. People living with serious illness are better able to manage physical and emotional symptoms and have peace of mind that their care is consistent with what matters most. Families and caregivers feel supported and better equipped to help their loved ones. Clinicians experience greater professional satisfaction and less burnout. And the health systems actually benefit from better quality of care at a greater value and an expert, stable, resilient clinician workforce. So all around, palliative care benefits everyone involved. Some additional benefits of palliative care is reduced pain and other distress, improved health-related quality of life, high patient and family satisfaction with care, and increased likelihood of location of death being outside of the hospital, and then reduction in hospital and ICU length of stay. Folks are getting better care in the home setting through palliative care support. So thanks to advances in medicine and technology and innovation, people with serious illnesses are living better than ever before. So a 2010 study, lung cancer patients receiving early palliative care received less depression and improved quality of life. And they survived almost 3 months longer than those who did not. The evidence suggests that compared to conventional care, specialist palliative care teams improve patient and family satisfaction and increase the time spent at home by patients and can reduce the amount of time spent in hospital. So we have this great visual. This is provided for the Center to Advance Palliative Care. It shows a lot of the benefits for it. You'll notice that things are reduced on the bottom setting with all the arrows. Readmissions are reduced. Cost of the day, 20% cost per day is saved. Admissions are reduced. Hospital and ER transfers are reduced, and total costs are reduced. All of these things are reduced because people are getting better care in their home setting. So it actually goes to show that palliative care can be a very helpful resource for people facing serious illness. And there is a high satisfaction and positive patient experience. 93% of people actually found that palliative care helped to benefit them during a serious illness. So, Jeannette, where can we find palliative care?
So actually, I thought what we could do is I would read a case study. Again, we had hoped to show you some movies where people would tell their own story, but since we don't have those, we are flexible people, and in our back pocket we do have a case study. So I'm gonna read that for you to get an idea of what it actually looks like to get palliative care. So this case study is from Laura. Laura's 72. She's enjoying her retirement. And then she noticed that she was having trouble keeping up with her friends on their walks. So she went to her primary care doctor and then to a heart specialist and found out that she had had a silent heart attack. So a few weeks later, Laura had another heart attack and ended up in the hospital with heart failure. A nurse named Nicole came to see Laura, and Nicole explained that she was a nurse on the palliative care team, which meant focusing on helping her to live well, even though she now had a serious illness with her heart failure. Nicole, the nurse, asked Laura what was the most important to her about her care, and then helped to arrange support that Laura didn't know existed. This included giving her medication for nausea, helping her with how to talk about her illness with her grandchildren, and a social worker, love social workers, a social worker to provide support to Laura's husband. Again, as we mentioned before, this is a team approach. So what Laura thought was the most important things: help with the medication for nausea, talking with her family, and supporting her husband. A few weeks after starting palliative care, Laura is starting to feel normal again and back to enjoying many of the activities she used to do. So the story, the case study is a good one to illustrate about palliative care. She's still getting treated for her heart failure. She's being treated as well as those people that are important to her. And the nurse asked, what matters to you? What are the most important things to you? And that was part of the plan of what kind of care that she was going to get. So that's why we talk about the extra layer of support, people that walk alongside you, and people that create, and that hopefully palliative care will be creating a plan so that the most important things to the patients are the ones that they concentrate on. So that was our substitute for the video. I hope you folks go and watch Andrea's video. It's really wonderful. I put the link for the 3-minute video. There's also a 17-minute video. She's very, Andrea is really a wonderful storyteller and very clear that palliative care helped her family, as well as helping her husband. So hopefully you can go and watch those videos. Okay, so next slide, please. So the question is, okay, I think palliative care is great. Where do I find it? So it's important to remember that there's basically 3 different sites where palliative care is available. The first one is inpatient. So, and friends will tell me, oh my gosh, my grandfather, he had a heart attack. He's now at Queens, at Kaiser, at Castle. What should I do? It's like, well, listening to the story, why don't you ask for a palliative care consult? So that's the word. Ask for a palliative care consult, which means that the palliative team would come and consult with you to help what's going on. And usually that's an internal referral. So the physician would be able to do that. But that, if we're going to make a t-shirt or a hat or whatever, that's the button. Ask for a palliative care consult. The second place that palliative, and as we see, Queens has a very robust program. Kaiser, Castle, HPH is Hawaii Pacific Health. So that is Straub, Palimomi, Wilcox on Kauai, and also Kapiolani has a very strong program for pediatrics. Maui Memorial also has an inpatient palliative care program, although I will say I don't know the details today. It's been sort of evolving. Best thing to do is ask. Okay, then outpatient. There are 3 outpatient oncology clinics with Queens, Straub, and Palimomi. Kapiolani has a pediatric outpatient clinic, and then Kaiser, coming soon, will have a outpatient palliative care clinic, and that's actually for all lines of business, not just oncology. So that could have, for instance, been something that Laura in our case study could have taken advantage of. And then the question is, where do you get this at home? Okay, I hate to say it, but it matters what kind of insurance you have. So welcome to America. It matters what kind of insurance you have. Fortunately, there are some very strong programs in Hawaii. And again, our advice is always ask the health insurance company. The first one is with HMSA. HMSA has a supportive care benefit that is a in-home palliative care benefit. UHA, they call their benefit concurrent care, again, in-home care, and the VA also has in-home care. If you happen to live in Hilo, they have some other programs that are going with Ohana and United, some pilots that we hope will go statewide. And then I learned last Friday that Aloha Care has also started a palliative care benefit. So if you have Aloha Care, ask about that and tell me. We're trying to learn about it. But for the most part, you can go to our website and learn about where to find palliative care. We actually have a page and a button that says, where do I find palliative care in Hawaii? Okay. Next slide, please.
Sorry to interrupt, but Navin Hawaii also has palliative care. Like I mentioned earlier.
Yeah, and I was
integrated care.
Thank you, Debbie. At the top of the next slide, you will see that agencies such as Navion have a palliative care program. And again, everybody calls it something a little bit different. So Navion's is integrated care, like Debbie was talking about. Kupu Care is in Hilo. Bristol has something called the AIM program. I get confused too, so you can ask. But yes, Debbie, Navion has an excellent integrated care program that is really, this is what we are talking about. So then when we talk about this space of in-home care, and again, most people really would rather be home, the agencies that provide hospice also provide palliative care, which is part of the confusion when people say, wait, but hospice isn't palliative care. No, it's not. Think of it as two separate lines of business, if you will, or two separate types of care and support that's being offered. However, the agencies provide, agencies can provide palliative care and they also provide hospice. Then depending upon the agency, they may have separate teams that provide palliative care and then switch to hospice. Some agencies will have one team that's with you the whole time. There definitely is additional training for the specialty of palliative care because, as we talked about, people are maybe getting curative treatments. So if you have a cancer patient, she's getting radiation and chemo along with palliative care, that's going to be then different than hospice, where those curative treatments then are stopped. So a lot of training that goes on for people. And as I mentioned, basically, it matters what kind of health insurance you have. Some agencies, including Navion, have an ability to do a small amount of what people sometimes call charity care, but as you can imagine, that's really expensive. So in case your son or your mother-in-law or somebody in your family works at a health plan at a senior level, please lobby for more palliative care. We need them to pay for palliative care. I think that's really important. Okay, next slide, please. So we hope that you can go to the website and find all of this information. Next slide, please. And it changes the focus in our conversation about it. So I thought there was another slide there. Isn't there a slide, Hope, about what's happening with palliative care in Hawaii? Maybe much later.
Maybe much later.
Okay, good. Sorry about that. I thought I knew my slides. So palliative care, it's important to think about, we're shifting what's the matter to me to what matters to me. And we saw that with the case study. You'll hear that with Andrea when you listen to her story. What's important to you and how do we help you? I heard a very moving story last week where people, again, in the pandemic, but anyway, when they were asked what matters to them, they're like, I need to feed my kids. Oh, okay, let's work on that. With Laura, she wanted help for her husband. Okay, how do we talk to my grandkids? Okay, let's work on that. So that's a really important part of what we do. Next slide, please. So it is possible to live well and have quality of life, even in the face of serious illness. And remember that there's various ways to help. We're thinking about comfort, physical and mental help, and that's an important part of the care, in that we look at spiritual suffering, emotional suffering, support that the person can get, connection, that's spiritual connection, family, friends, loved ones, social connection, preparation. How can you be ready? Thinking it's always better to be prepared so that crises don't happen. And I'll say, people say that to me all the time. Oh, I don't really need that. Well, then no one would ever buy insurance or buy a raincoat or an umbrella. Like, let's think about this ahead of time before you need it. And, these are important, very important parts of life. It is a rite of passage. And it's especially when we talk about hospice care. Okay. So these are important things to be thinking about and being proactive when you learn about treatment options. We know it's not easy. It's difficult to get a serious diagnosis. Always important to ask about treatment options and hopefully find a provider, and if not, tell the provider about what matters most to you. We really encourage people to have thoughtful, meaningful conversations about your wishes for care, what matters to you, and then to complete an advanced healthcare directive. If you should document who your healthcare power of attorney, who is your agent, who is going to speak for you if you can't speak for yourself. Again, people wait. Better 10 years too early than 5 minutes too late, especially if you're thinking, oh, I'm caring for somebody who's been diagnosed with dementia or mild cognitive impairment, just beginning. That is what you are doing tomorrow, getting an advance directive. I don't know how many people say to us, oh, we waited, grandma can't make her own decisions. Oh, you don't want that to happen. And then on our materials on the Kōkua website, there's the information about how to share that. What was the last one on that slide, Hope?
This one?
Right, post. And then if someone asks you to complete a post, which is for someone with serious illness, not to be confused with the advanced directive, but that's a different training. You can find all that information on our website. If someone asks you for a post, you would be eligible and appropriate for a palliative care consult. So that's a good
and if I may, if
Please.
you have a post already, please complete an advance directive as well. You should have both documents to support you through your healthcare journey. A post is very important, but advance directives are also as important because you want to make sure that you have a voice and an advocate for yourself, and that's named in your advance directive. So if you already have a post, great. Go ahead and finish your advance directive as well.
So it's important to remember, and our slogan is everybody needs an advance directive, not everybody needs a post. Kōkua, we are the point agency for post. I heard from somebody last week who said, oh, my doctor is trying to convince me to do a post, even though I'm a healthy person. That's not good. We need to educate doctors about what post is. Sometimes they get it wrong. So if you can help us with that. However, for people with serious illness, a post is very appropriate. Out of hospital medical order that documents the care plan. So please feel free, contact us if you have questions about post, and it's on our website. So this is the slide I was expecting. Good. So we really, over the last 2 years, we have an amazing team, including somebody on our call today, Anita Jewell. We recognized that a lot of people do not understand. I'm sorry, Debbie's on our team too, recent addition. Yay, Debbie. What we realize is that a lot of people don't know what palliative care is. Either they've never heard of it, which is fine, or they think the wrong thing, which is not fine. And that can be doctors, providers, as well as the public. So we are really trying to get people aware of what palliative care is through talks like this. So we have a bunch of web pages. We'd love you to go there, take a look, see what you think, to help explain what palliative care can do. Is it right for you? Where do I find it? This is a good place to watch some of those videos. The bridge that we couldn't show you, that is there. Some of these other interviews are up there as well, and as well as a very nice interview about the difference between hospice care and palliative care. So we hope you'll go there and please give us feedback. Next slide, please. So important to tell you, there's lots going on right now with palliative care. We see that there is a really big opportunity and a lot of excitement. And don't be thinking this is overnight success. We have worked on this for at least a decade. So overnight success after 10 years of hard work. So one important thing that's happening, we hope, is that we would be the first state in the country to have a CMS approved, governmental approved palliative care benefit for MedQuest members. So those are people that get Medicaid. At the moment, a third of our state gets their health insurance through Medicaid. It's a huge number of people. So if this actually happened, that would mean that we would be able to provide care to a larger group of people. So we really hope that that will come. And part of what we're trying to do is get ready. So what we've learned from other places is just because you build a great benefit, people don't come. So we really want help in getting the word out about what palliative care is, and that is both to providers and to the public. So if we have any providers here, people who work for agencies, or again, if your daughter's a doctor and she has a practice, or somebody works at a health clinic, we have a fabulous toolkit that we have developed to help increase referrals to palliative care. So that's the business side of it. And we're always looking for opportunities like this to help people understand what palliative care is. So advocacy groups, we've had a couple of trainings for people with cancer. And actually next week at the Cancer Survivor Conference, I was asked to talk more about palliative care. That's what we want. We want to be in front of people so they can understand what palliative care actually is. So please contact us. We're happy to work with you. In case you missed it, we had some amazing West Oahu students last year who did an Instagram campaign. I will say for our team, for the most part, it was a learning experience. Besides Hope, most people don't do Instagram, but social media, how do we get this out there? So it's good. And we also have, a number of other continuing education opportunities. So if you want to learn more about palliative care, visit our website and let us know. Okay. So just to clarify or also to repeat, what we have available are all these free materials and information around advanced care planning. So we talked about that. How do you make your wishes known? Everybody needs an advance directive. Where to find information about POLST. We have those in 10 languages. So if people are not necessarily, if grandma's losing her English, there we go. Recent immigrants, all kinds of information. Hospice, Navion has hosted us today. Navion's, of course, a great source of information about hospice. But we have, for instance, a listing of all the hospices, how to find the hospice on Kauai, what's going on in Molokai, listings of the hospices on Oahu. We also have a handout, how to choose a hospice. So we try to we try to be a trusted source for hospice. There's a nice video, I will say. George's last luau is up there. Was a national video about from I think it was old enough to be Hospice Hawaii, but anyway, George and his luau over at the home.
It was at our Kailua home when we were Hospice Hawaii.
Yeah, it's a wonderful video. And then grief and bereavement. We have something in Hawaii called the Bereavement Network of Hawaii, and we have a listing of the various support groups, counselors, things that are available in our community. I will say for me, I think that we as a community need to recognize what we have been through over the last 2.5 years. We're starting to go to funerals again. We're starting to do that. But for 2 years, we didn't eat noodles with everybody else after a funeral. We didn't get together. And I think there's a lot of unrecognized grief and loss out there. So pointing out to you, there's a bunch of good resources. We have, for instance, a listing of mortuaries and funeral homes with prices. Interesting. Go and check that out. And then we like to do trainings for professionals, whether it's this topic. Usually what Hope does is getting the conversation going, getting people more comfortable. She'll make you laugh, even though the topic is advanced care planning and documenting wishes. Okay. So I think, oh yeah, this was just the last piece. Do you want to take this over now, Hope?
Sure. So why is it important to make your wishes known? Why does it matter? Well, we actually work with some ambassadors. We call them our ambassadors. They are our speakers bureau. They volunteer their time with us. And these are social workers and nurses and doctors. And as ambassadors, they've chosen to volunteer their time with us because they have seen fist fights in the parking lot outside of the ER. They have seen what happens to families when they are not prepared and when they haven't done advanced care planning work. This is really a gift for your loved ones. This is something that you can do to ensure that your wishes are known and that your loved ones don't have to guess. So this is an important part of the space that we're in, but this is something that everyone over the age of 18 should be doing. It's not something that we are reserving just for people once they're facing a serious illness. We want to make sure that you folks have that opportunity to talk about what matters most to you when you're healthy. Talk about it and share with your loved ones so that they know how to support you in a time of crisis. So some of these ideas is around advanced care planning is that you could speak up and have a say in your care. You can actually help to navigate where you're getting care from by knowing what matters to you. Getting healthcare often involves choices that impact your life and well-being in different ways. So depending on what kind of care you want, it could alter where you're getting the care from. And treatment only works if they work for you. So, if you're getting cancer treatment and it's just not viable, it's not something that's working well for you, then it's not really working for you, right? It may be working for your body, but if it's not working for your well-being, it may be something you have to consider changing. But advanced care planning is truly a gift for your loved ones. So we encourage everyone out there to go ahead and have these conversations about what matters most so that folks can come together during a time of crisis rather than fist fight outside the parking lot at the ER. So what resources do we have to help with advanced care planning? Well, we have a website that's actively managed, and it has all of these resources on the website that are free to download. We use materials from the Conversation Project. They have starter kit. They have information. They have booklets and workbooks that can help people with serious illness, people who have children with serious illness, people who are caring for someone who has Alzheimer's dementia, how to choose an agent and how to be an agent, and how to talk to your doctor. These are all materials that are available for you for free from our website or from the Conversation Project as well. We also want to make sure that folks recognize that POLST is not for everyone. As Jeannette said, everyone should have an advance directive, but not everyone needs a POLST. So it is intended for folks with serious illness. If your doctor is handing you a pulse form because you've reached a certain age, we encourage you to hand that pulse form back and say, I don't, do you know something I don't know? Because that's intended for people with serious illness. So we do want to make sure that you know that there are 10 different languages on our website. We are looking to expand our languages to include additional languages. And if you'd like a training for your staff, for your church, for your book club, give us a call, let us know. We are happy to do trainings on advanced care planning as well.
So Hope,
Yes.
Thanksgiving is coming.
Well,
You have any tips for people?
it's funny that you mentioned that. So one of the things in advanced care planning is talking about what matters most. And so we had Reverend Rosemary Lloyd come from the Conversation Project, and she shared a story. And November is National Hospice and Palliative Care Month. And so in the month of November, she was doing a series, an end of life series in her church. And one of her parishioners came up to her, was so excited to have the conversation with her loved ones. She shared her Thanksgiving invitation. And on the invitation, there was a time, there was a date, and at the very bottom, it said, there will be no pie until you tell me how you want to die. This was such a brilliant, non-intrusive way to get the conversation started. Anyone who was brave enough to go to Thanksgiving dinner knew what was coming. It was not surrounding somebody with a serious illness. It was just, we're together. Let's talk about what matters most. So we encourage you, if this is something that you think motivates you, have that conversation around Thanksgiving dinner, but prepare your people first so that they're not walking in on something and getting sideswiped.
Yeah. And you know, the holidays, people may be coming home, flying in. It's a great, it's a chance to talk to people. And again, better to be 10 years too early than 5 minutes too late. So think about that. Think about our materials. A couple of tips or ideas. We challenge you. Why don't you find a buddy? You guys can try and do it together. Like Hope said, warn your family, but you can share all this stuff. And the other thing people always say is, oh gosh, Uncle Chemo is not doing so well. We need to do that. It's like, you know what? That's not fair. You start with yourself. And this is what I do. These are my wishes. This is what I'm thinking. I want to share this with you guys. You hope Uncle Chemo gets the hint. However, you got to start with yourself. You can't just look at the other people. But we have a bunch of good, tips on the website, but think about it before the end of the year. We've got a couple holidays coming up. People may be coming home, time with family. And especially if you have people in your circle who may be facing serious illness or getting older, boy, just so much better than having a crisis.
So these are the materials that we have that's been translated into the 10 different languages. Again, they are on our website, free to download. Some other things that you can do to be a part of our movement to improve care, join us on our mailing list. We send out email list, and it has information on meetings that are coming up. They have information on Death Cafe, things like this event, all these types of things. We help to promote them on our mailing list. And as Jeannette mentioned, there is a guide to funeral and mortuary services and costs in Hawaii. And I will tell you that document I'm sure it has saved some of my loved ones money by just knowing that there's a substantial differences out there. So again, if you'd like a training on advanced care planning, we're happy to do that with you. This is our contact information. Feel free to jot that down or go to kokuamau.org and take a look at our website. You can contact us through that as well.
And I noticed that the kahako got over the O in our addresses. So no need to do that. You don't need to do that. You could, yeah.
So thank you all.
Yeah, and Jim, that's a nice, Jim, thank you and Kathleen for your support and membership in Kōkua. But I love this idea of the best holiday gift. And what's interesting, I remember years ago when we were talking with a group of advanced practice nurses, and one of them had taken on a project to do conversation, like ICU work and conversations. And she was very surprised that we didn't know, what that was me, I didn't know that fist fights in the ICU were a normal thing, because people were disagreeing, totally tense, everybody's really worried. So she's performing CPR and she has to call the police because people are fighting in the ICU around her about what we're going to do with mom. Just such a chilling thing. But she said, oh my gosh, doesn't everybody know that there's fist fights in the ICU? I said, no, everybody doesn't know that. We don't know that. And Hope's, story, I keep think of a couple people who, it was a doctor and a lawyer, and he said, I found myself ready to punch my brother in the cafeteria at Queens because we were disagreeing about this. Oh my gosh, like this is very real. And people say to us all the time, oh my gosh, there's going to be, hoo-hoo with the kids. Well, if there's going to be a problem, like now's a good time to address that. Anyway, so we're very happy to ask and answer any questions. If you need more, otherwise we can just sit here and chat for a while, but we obviously, Hope and I and the people of Kōkua Mau and our members, we're really trying to get the word out. So, and now, Hope does tons of, well, I help a little bit too. We do talks on Zoom, but it's hopefully the pandemic puts us in a place where people think these conversations are not quite so strange as they used to be. So we hope that you guys can also think about other ways to get the word out. So Debbie, did you see any questions, or was there anything else you wanted us to?
Not right now. Thank you for that presentation. I know the videos weren't working. So after this webinar is done, if that's okay with you, I can go ahead and send out the slides as well as the links to the videos so they can watch that when they have time. Yeah, if anybody has any questions, feel free to type it into the Q&A box or even the chat. Otherwise, I guess, did you want to show that one slide with their contact information just in case they have any questions that pop up later?
Sure.
Yeah, and we've gotten a couple of invitations lately to talk to professional groups, which is great. Oh, our meeting is coming, or oh, we just missed the Filipino Medical Association. Hey, we are happy to go anywhere and talk to people. We really want to get the word out. So, and again, churches and temples and other groups have really been a great place where people talk about these issues. So we are happy to help.
Perfect. Well, I don't think there's any questions, but I guess you all have Jeannette and Hope's contact information if any questions come up later on. Otherwise, thank you all.